Let's continue our discussion with Dr. Shahid, this time about the different registration pathways.
When someone's applying for registration, there are different pathways that they can apply through. The standard pathway is when you're applying for your standard pathways when you sit for your AMC MCQ exam as well as your clinical exam. Or if instead of the clinical exam, if you're able to get workplace-based assessment in a hospital that's providing supervised
Hmm.
practice for you for 12 months. And then you get your registration. That's the standard pathway. The competent authority pathway is that if you've actually worked overseas, if for example you've done your PLAB and you work there for, or you've got your GMC registration and you work there for 12 months, then you are eligible to come to Australia and work here on a competent authority pathway.
Hmm.
Um, and these are all the countries that is actually, this is again from the AMC website, where people who've done their USMLEs, their Canadian Council exams, the LMCCs or the PLAB, and it tells you how you're eligible. And some people might take that route where they might go to just for experience, or just to get a bit more exposure. They might go to a different country. For example, a lot of my friends have done this, and Faraz, I think you've done the same, where you've worked in the UK, and then
Exactly, yeah.
you were able to come here on a
Yeah.
competent authority pathway. Is that correct?
Yes. Category
Yeah.
A of competent authority.
This just slide highlights the different bodies that are recognized by APRA and the Australian Medical Council. And finally, there's the specialist pathway, and some of my friends have recently migrated from Pakistan, and they've completed their FCPS back in Pakistan, and once they've or their MCPS, and they've applied for some specialist equivalent pathway, which basically means that the APRA as well as the AMC will find an equivalence of your
Mm-hmm.
training back in your country and see what you're eligible for. And they might give you some leeway, say, hey, you've completed 4 years of training, that might be equivalent to 2 years, let's say, or 2.5 years in Australia.
Mm-hmm.
And they might give you a jump start that you can actually enter a training pathway in here. Um,
Mm-hmm.
I've not seen anyone come on a surgical, a specialist pathway in the surgical stream, but some of my friends have just come in the medical stream as basic physician training, which we'll
Mm-hmm.
discuss in the next few
Sure.
slides.